So if there's a relationship with autism, ADHD, and atopic dermatitis, is there a relationship with atopic dermatitis and stress? And then does that tee us up to there's some immune response that could be related, or am I overstating that?
Well, we're going back to the T cells. You're talking about the inflammatory hypersensitivity, inflammatory system that's already hyped up for atopic dermatitis. And going with all those other diseases that all respond to inflammatory reactions. They're all external stimuli. So you're stimulating this in the secondary inflammatory system. So yes, with one goes with the other. How's the diet? Stress always makes everything worse because then we have dopamine receptors going on serotonin. Yeah, exactly. Everything is all sparking off. So when you do this, what T cells are associated with it? The inflammatory ones that are mast cells. And when you start to get inflammatory mast cells, histamine just releases. And what happens? You start to scratch. But also the other histamine receptors in your stomach, right? H2. So now you have the acidic acid indigestion, GERD, all that, which would go with celiac disease and all those other diseases as well. So yes, hypersensitivity of the sound, touch, stressors all would make atopic derm just flare out and be associated with all those other conditions that do the same thing. And there's definitely more study that needs to be done. It needs to be looked into these links because they can't communicate as well. So how do you treat them as well? And then, people think, oh, you're fine. They're not fine. Lack of communication, especially for like autistic children who are very smart. So it's just that lack of socialization and communication they can't give you.
Yeah. And so then the next issue might be, have you found that when their autism is underneath better control or ADHD is underneath better control, do you find that the atopic dermatitis gets better, or is that an overreach?
I think we need to study that more, but I would think that it would.
Yeah.
I would think that all are part of this inflammatory cascade. If you can fix one, can you fix the other? Yeah, so I would go further into that, and I think more research needs to be done with it.
So this leads us right into these special populations. How do you approach patients who are, let's say, pregnant with atopic dermatitis or infants who have atopic dermatitis?
So pregnancy, you got to be careful with everything that you approach with because you don't want to damage the unborn child, or in a sense, at that same time, damaging the mother as well. So you're going to do less. It depends on you have to be in communication with the obstetrician, make sure that they're okay with topical corticosteroids because you can be, even though they're category C, and you want to just know, is it more harmful not to treat her than to treat her? So definitely, but antihistamines are safe enough to use and topical emollients and taking away things. But the calcineurin inhibitors like Elidel and Protopic you can use. So you can use those as well. They're non-corticosteroid cream, and you can use.
And that's for infants as well?
Infants as well. And I treat infants with corticosteroids. I have no problem with that. You do them for a shorter period of time, but you definitely want them to stop scratching. And they're the oral versions of the antihistamines as well.
Okay. And what about the elderly? How do you approach them?
They can get any medication they want as long as they ain't got the comorbidities that inhibit them from getting it. They can get Dupixent. They can get all that. It's 12 and above. I'm sorry, Dupixent is 6 years old and above. So you can go down into 6-year-olds and up and above. I mean, if someone is elderly, not every elderly person has a bunch of comorbidities.
Yeah.
So you can treat them with Dupixent, you can treat them with Rinvoq, Cibulco if they're very severe, but they're good at topical corticosteroids. And then you have to think about homeopathic ways of treating people. Like Flexidor is really great with anti-inflammation if you can tolerate the taste, but it works really well.
What is it again?
Flexidor. Flaxseed oil.
Oh, okay.
Flaxseed oil is excellent. You can use it for psoriasis or eczema.
Put it in your food or?
Yes, you got to be able to swallow that. As long as you can swallow it, it's good. You can do it. But, yes.
That is excellent. So let's get into what is the future or innovative management interventions that are in the horizon for atopic dermatitis, and what is some of your most promising kind of research that's out that you're excited about?
Well, there's going to be probably a slew of more biologics, just the same way it happened with psoriasis. Psoriasis, they came out with one or two, and now there's like one. There's so many. So, there's got to be 20 at this point, because there's so many different companies that come at it from a different point of view, a different perspective, or a different target. I mean, just a few years ago, there was no oral or injectable for atopic derm, but now there are 5 different ways that you can approach it. So I'm pretty sure that there's going to be more biologics, more orals, less harmful topicals that you can use that are just going to bring down the inflammatory cascade.